We're talking about this Verda Tate, the Fitchburg graduate, Fitchburg, Massachusetts High School. And she received what is known as the General Excellence Award, which they've been giving at Fitchburg High School since 1914. Now, it's a scholarship worth $40,000 over 4 years. And you say, well, that's maybe not a lot of money. Yeah, maybe not, but it's $40,000. And after posing for a photo, Tate returned to her seat, and DiGeronimo, who's the principal, went on to deliver kind of a commencement speech. When DiGeronimo finished, Tate returned to the stage one more time with a very surprising decision. She said, quote, "I am so grateful for this award, $40,000, but I also know that I'm not the one who needs this the most," said Tate. "And knowing my mom went to community college and knowing how much that was helpful, I would be so very grateful if the administration would consider giving the General Excellence Scholarship to someone who is going to community college, because I know it is such a great honor, but I also know I am not the most in need of it." And, if you're worried about, our next generation, here's an example of one of the people that you don't have to worry about, and she's heading off to Harvard for her continuation of education. With us this morning, Dr. Matthew Howie, Medical Director of the New York City Bureau of Health. He joins us here on WSBA. It's funny, Dr. Howie, I know this isn't on our list this morning, but when you hear about as we get older, we're always worried about the next generation, and we're always going back to when I was a boy, when I was a girl. But here's a young lady that knows about, giving to others and kind of an interesting moment.
Oh, absolutely. Pretty extraordinary when you think about it. I got 3 college-age and graduate-age kids. Those are the moments the parents dream of, actually.
Yeah, absolutely. And here's a girl who's giving to somebody else at the same time, probably also reaping some other benefits as a result. But good stuff to hear. Anyway, I wanted to talk to you. I was out at dinner last night. I'm seeing so many interesting things that are happening right now when the rubber meets the road. So we're at dinner. Most people coming in without masks on. And then I see a number of people who are coming in with masks on. And I'm thinking that's a habit. Or maybe they haven't gotten the vaccine yet for whatever reason. I was interested. There were 2 guys who walked in last night to dinner, and they both had masks on, walked back to the back, sat down in their chairs, and they left before we did last night. Both walked out without masks on. So they come in with the mask on, they walk out without the mask on. And I guess sometimes that can be, you're not sure what the establishment wants you to do, and then once you get in there and you get the idea of what they want you to do, you can go out that way. But it's interesting to watch all the changes that are happening right now. What's your take on what's going on now as we come out of COVID? And yet I know you've been very careful in saying, let's just be a little careful along the way.
Yeah, I think that we've all kind of had that struggle with mask or no mask. Especially if you travel, if you go to a different region of the country. I was visiting relatives in Maryland, and that was the same debate we had. Like, we're going to go into this store, mask or no mask, and we kind of have to remind each other, hey, take the mask with you. Very easily could have that sign on the door that says wear a mask. Restaurant is a particularly tricky piece because we've already learned we're going to take them on. We're having them on when we go in. We take them off when we eat, and then hopefully put them back on later. But it's new human behavior. This is kind of awkward, and we're in this odd transition period for sure.
I think it's interesting. For a while here during COVID, if you didn't have a mask on, you were in the minority, and people would look at you and you get some bad looks or whatever. I heard different people say about that. I was not one of those. I wore a mask where I was supposed to wear a mask. But now you look at people who are wearing masks, they're kind of in the minority in a lot of cases, and you're in the majority. But we shouldn't be putting maybe value judgments on things. We don't know. Maybe they have a pre-existing condition. Maybe they're sick. Maybe they haven't been vaccinated. Those are all the various things. My wife reminded me about that last night, who's a healthcare professor. She said, listen, you don't know. There's 8 million things that could be going on there, and we just have to respect the fact that we are in a different time, and we are in this transition period right now, however long that's going to last.
Absolutely. If you take a look at a mask, the majority of the masks that are worn, if you think about it, they're actually trying to protect those around them. Those aren't N95 masks. Those are kind of routine masks now. We've all kind of got accustomed to. But you're right. You're way spot on. We don't know the individual condition of that person. I work in healthcare settings. Very clear that we need to maintain being masked in those settings. That's where the guidance is. So, I think that it's hard to constantly be thinking, like, is this a mask or no mask? So a lot of us have just adopted that when in public we're going to have masks. Just because it's easier for us to remember. I go to a lower back pain specialist, and we still have masks on when we go in there. So I take my mask with me, and I have to have it on the whole time I'm in there. And I said, "Do you still have to have it?" And they said, "Yeah, we do, because we have
people lying down on tables and breathing on things and all that kind of stuff. And they're very, very careful in there. So, I respect that. I mean, I really do. And I think that's the thing that we maybe as the public need to be aware of. We need to have a little bit of understanding here. And I think sometimes that's missing in this day and age where politics has kind of seeped into this whole thing. Do you see the same kind of stuff?
Oh, for sure. I think that you can extend this beyond the mask. I think this idea of making room and space for others is just an important concept. It's one that isn't always reinforced in the broader conversations that are being had, but it's such a critical one that we really do need to allow for different perspectives and different interpretations of what's the right thing to do. At the same time, we got to make sure we're staying as safe as we possibly can.
We're talking with Dr. Matthew Howie this morning, Medical Director of the New York City Bureau of Health. Dr. Howie, when we look at this whole thing right now, what are the things that are most concerning to you as we're transitioning out of the COVID period? And many people have already transitioned out. I mean, you look at the beaches, you look at the places you're going. I was at doing volleyball semifinal championships the other day. The stands were packed. I mean, it's great to see, and yet at the same time, I'm sure as a doctor, you're still kind of looking and saying, there's a few things we've got to be aware of here. What are some of the concerns that you'd like to pass on maybe to people right now that you're thinking about?
I worry about the out of sight, out of mind. I mean, we're definitely seeing an improvement of hospitalizations. Things are improving and getting better in terms of transmission rates. Part of that's seasonal, part of that's immunization, part of that's natural infection in the community. But when it's out of sight and out of mind, we stop doing the things that we know are best practices to do. And then the one thing that I think that right now is our investment in our fall and in our winter is immunizations, and that prioritization of that is an important step. I think sometimes falls to the wayside. We need to keep pushing towards that.
One of the concerns that people have now is the low vax rate, that it's really dropped down, maybe because of that attitude that I mentioned to you. And we're seeing the closure of certain centers, and we're seeing that people are not showing up to get shots anymore, thinking that, the coast is clear. What would be your response to those kinds of numbers and those kind of things we're seeing happening in front of us right now?
Yeah, I mean, I those are the things that I do worry about. Everybody has their things that they pay attention to. Those are mine. When we take a look at that space, this is our investment in our fall and in our winter. If we want to continue to have these activities where we can go be together, which we all want to be, we have to invest in it now, and part of that's going to be vaccination. This is a seasonal type virus. I expect we're going to be, dealing with the issues of this seasonal virus in the fall and in the winter. And the best thing we can do right now to protect ourselves later is to protect our community now through vaccination. We're
with Dr. Matthew Howie, Medical Director of the New York City Bureau of Health, who has been a kind of our go-to guy here during this whole COVID time and has been giving us great information. Dr. Howie, summer travel, that's one of the things that that people are concerned about. And I guess maybe just a prescription for, going about the summer. We're right at the beginning of summer right now, and people going out and doing summer activities. You want to have a great time, and yet at the same time, you don't want to forget about this totally. What's the best way to proceed this summer, still have a good time, and still be aware that this is around, COVID that is?
I think having that habit, every morning I get up and I take a look and I have the whole glasses, watch. I don't have a watch. Glasses, cell phone, wallet, and keys. And it's just a standard routine. I think having a mask in our pocket has just got to become part of our regular routine. It makes it a whole lot simpler to deal with when you have that moment of, oh, my goodness, I'm going to go into this space. It has a requirement for a mask. If you make that part of the routine, it's a small adjustment to make to our new world.
It's interesting. In our state, the governor said, well, we wanted to get to 70% herd immunity rate or 70%, vaccine rate for all adults, or June 28th, whichever comes first. What are your thoughts about that? You say, well, geez, if we're not at the 70% and June 28th comes and we're just not going to wear masks, what's that all about? What are your thoughts about that as a doctor?
Well, I think it's good to have these targets, these things that we take a look at and we can all rally around, hopefully, as a community, to kind of shoot for. I'm not 100% certain we're going to be able to get to that by that date, but it doesn't mean that we're not going to have that message out there of how important this is. Those of us who are working on vaccine hesitancy issues, this is still a very active conversation that we're all having about how do we get those folks who are just a little on that fence, saying, I'm not sure, I'm going to wait, to really be comfortable with it. Communities that we haven't really been effectively been able to get that message into, how do we creatively get into that space? Because we want folks to be protected. This is all about benefiting the community and benefiting those individuals. And how do we get that message out there effectively?
This past weekend, we had a chance to see a notable situation where someone who did not get the vaccine had to pay a pretty bad price. John Rahm, the professional golfer, was out there, and he came across someone who was infected. And before the tournament, and they said, well, you can go ahead and play in the tournament, but we're going to test you every day. You can't use the regular locker room facilities. You can't, do a lot of the things you might normally do, but we're going to let you stay in the tournament, and you have to get tested every single day, which he did. Tested negative every day until the last day on that Saturday, where he gets a hole-in-one that morning, shoots a 64, has a 6-shot lead, looks like he's going to win the tournament going away. $1.7 million goes to the winner, and right after the round, he's told, hey, you tested positive, and we double-checked it, and it's positive, and you can't play tomorrow. And, of course, social media went wild over that. But that was probably the best example we've had so far of someone paying the price of not having the vaccine and, also still coming across someone who was infected and the protocols were still in place. What was your take on that whole thing?
It's really unfortunate. You can't but be compassionate for that situation.
Absolutely.
At the same time, the rules, they are where they are. They set them up there, and following through with them is the right thing. When you do not avail yourself of this vaccine, that is a personal choice. I'm not going to argue against it, but it does have consequences potentially that go with it, not just for you, but for everyone around you. That unfortunate situation did put those who were in those groups walking or doing those 18 holes with him at risk. He was potentially infectious during that period when he was walking with them prior. So it speaks to that really difficult thing about personal choice and personal freedoms versus the right of the community to feel safe and to be able to be safe.
Yeah, where do your rights kind of cross into my rights is really one of the questions that came out of that. And of course, on social media, a lot of people were saying, why can't he just play by himself tomorrow and go out and play? And that was not included in the protocols. And they said, well, basically, we'd be putting him out there on the course knowing he was infected. Liability really does come into play there, doesn't it?
Oh, it certainly does. And if someone had tested positive the day before the tournament, they wouldn't even be able to be on the green with them,
right.
On the course with them. So I look at that as, this is we're using the best interpretation of the guidance that we're getting and applying it, and we need to be consistent with it. And golf is all about rules. I'm not a
right.
golfer, but they're very clear guidelines and rules. You don't sign your card the right way. You don't mark it the right way. You get disqualified. I don't think this is new and different. I
am a golfer, and I understand that, and I guess that's why it's easier for me to look at this and say, hey, you knew what the rules were going in. Here's what happened. It's unfortunate. Again, a lot of compassion for what happened to him, and yet at the same time, he said, hey, I knew the rules. I went forward. This is the way it was, and I have to learn by this. So now let's get to that point of vaccinations or not getting the vaccination. There are people who fervently believe I am not getting the vaccination. I'm not putting that in my body. And there are other people who say, that I'm helping out society. I'm helping out myself. I'm making others safe. I'm making myself safe. As a doctor, how do you explain to people then who are not getting vaccinated, why it's maybe a bad thing not to do that? I just a couple thoughts on that.
I think we have some illustrative points. This is a good one here. Fortunately, he didn't have any bad health outcome that went with it. But,
right.
There are still individuals getting very sick from this infection. That continues to this day. I think for the most part, the lessons that when I talk about vaccine hesitancy, the first thing I want to do is ask questions before I point my opinion anywhere. I want to understand where that person's coming from because they got reasons. And I may not agree with them, but if I don't understand those reasons and respect that person's opinion, a right to have an opinion, we're really not going to go any farther in the conversation. They need to understand that's where we start from. And when you start from that position and people get to explain themselves, often then they are more self-heard. They are more open to that conversation. And that's what you want, is it to be a conversation that allows room for answering of questions as well as for people to hopefully feel safe to change their perspective if need be.
Dr. Howie, I always appreciate your expertise and your insights and your compassion, by the way. I think you handle it very, very well. Thank you so much for joining us this morning. We look forward to catching up with you again very, very soon.